can we help there?
Okay, apart from the things that I have mentioned, where we need to see the adjustments, there is the regulation of the specialists, yeah, and also the doctors who need to be held accountable at some point, because some of the things that we see are like they go scotch-free because you're such a big doctor and you feel you're untouchable, and this is a small parent at a corner. Justice is one of the things that I hope we'll be able to champion for. There are policies that there is the act being amended. For me, in this capacity as a board director right now, actually why I believe I was placed there is to be the voice of especially the neurodiverse and at the same time the parents. Because you will find if you look at the act for the Disability Act, everything is beneficial to the person with disability. But the reality is, if you do something like the car importation, tax-free car importation, to the living. So that's just hope. I have to take care of them. So as a caregiver, can that come to me? If we look at the implementation, like I've just said, in terms of accessibility, yes, it says that all buildings should be accessible. But then that's a different department in our setup, because sometimes you find even there are some hospitals that some areas are not accessible, and like even some basics like the toilet not being big enough for those who are wheelchair users. And sometimes you will find some of our big children are still in diapers. You have ever tried changing a diaper in a toilet where there is nowhere to place things? There is nowhere, and the ones that are there are for infants. But then you have an adult. So those are some of the small things that are there, that the policies are being put in place, but we are not implementing them, and we hope to champion for that. The other thing about medicine, we're trying to see if NHIF can do something about it, or even tax, but then we're told as the National Council is an oversight, but then it's like a dog which can bark but that cannot bite, because you don't have powers to actually punish the offenders, So we're hoping to see a bit of changes in that. I know there is a lot of amendments that are in the second reading. The good thing is, at least I understand that we have in the provisional budget from the meeting on Saturday, there was the announcement that there'll be 100 million that will be allocated to the neurodiverse community. And I know one of the duties for me will be to guide and on how best this can serve the community of those with neurodevelopmental disabilities. So those are challenges. We're still being oriented, but once I'm fully in the system and my duties are well cleared, I hope to be of great assistance and use to the whole community and see where we can improve, even on the medical side and the education. Because if you look at the neurodiverse, health, education, social protections go hand in hand. But the difference we find is, even let's take, for example, medical assessment. Where do we go? Basically, it's we know there is Mama Lucy on specific days, there is Bagathi Hospital in specific days, and then there are the charges that parents are crying to be removed. Because remember, for those with autism, you need more than one doctor and several signatures. Yes, at least finally that signature from MOH has been devolved to the county. But then I know we're at the process of training of now the health workers so that they're able to give proper diagnosis. But one thing that I felt disappointed as a parent was when we were going through the diagnosis of neurodevelopmental, like every other disability was gone through in detail. When we got to autism, it was skipped. And I'm like, we're here to solve a problem. If our own ministry does not take it as serious as it should be, it's just another. And then clustering autism with mental illness, it's not a mental illness. That's one of the greatest things that pain.
It's a developmental.
It is a developmental condition. So let us have neurodiverse, neurodevelopmental conditions on one side. Yes, we have comorbid conditions underlying, but treat it as such. It's on its own. It's a spectrum. You can't put it under mental. Because when I spoke to Sylvia Kasanga when they were adjusting the bill, I asked her, is there anything to do with autism? She's like, what is that? That is not part of what we're dealing with. You guys, your issues are not captured anywhere. So we need to also just give it the attention that it deserves and cluster it well. If we don't understand, engage each other, engage the specialists that you have in that area to advise so that we don't do an injustice to those who are on the spectrum.
Yeah, and in fact, we've touched on
Hello?
the next question. Sorry, you can hear me? I hope you can hear me. You touched
Now
on the next question that I had was regarding advocacy. What areas, or because you see, like you, some parts specialize now.
I'm really straining to hear you.
Okay, sorry.
Hello?
Hello.
Hello?
Hello.
Yes.
Can you
I'm
hear me?
not so as clearly as before. I feel like you're a bit far now.
Okay, can you hear me better now?
Best, yes.
Yeah. So I was talking about advocacy. Right now, I can actually say you're a fully fledged specialist.
Right now, I can actually say you're a fully fledged specialist.
I am not getting you. You're breaking. You're breaking.
Sorry, let me just stick to one gadget. Can you hear me now? Hello?
Yes.
Hello?
Yes. Yes, I can hear you.
Yeah, sorry, Sylvia. I'm having a bit of technical challenges myself. So I was talking regarding advocacy, and I really wanted you to also give us,
to also give you what?
And things to do about advocacy in terms of our spaces, because it will go a long way, not just in autism. We can just strictly focus on. Over to you, Sylvia.
Okay, there was a time I think it went slow, disappeared. So I've heard advocacy fully fledged. Thank you. But then there is now the main question didn't come.
Yeah, sorry, I was just asking.
Hello.
What tips that you?
There's someone else who's also on. So I are you able to type so that I can at least see? Hello? Yes, but back to very far. I will just maximize my volume. It's on maximum. Let's see.
Okay. Dr. Lucia, I can see you've joined us. How are you? Dr. Lucia?
I can hear you a bit far, but I can hear.
Dr. Lucia?
Hello.
Hello.
Yes.
Can you hear me now?
Yes, perfect. Thank you.
Oh, sorry. So I was just saying, maybe you can touch a little bit on advocacy, and like the event you had this week, which was all across Africa. Can you tell us how we, as the healthcare workers, we can also engage in such activities?
Okay. Thank you for that question. So through my foundation, it's not a foundation, the organization, Andy Speaks for Special Needs Persons. Autism is the key disability that we focus on because that's what I know best, but I try and support all the neurodiverse because we're all walking the same journey and the same challenges. So every year on World Autism Awareness Day, we have a ride where we bring either riders and cyclists. Then we do a procession. So like I mentioned, 2019, we did 19 counties in the hospitals, but then that was one person riding. And then we got the feedback from the ground. 2020, of course, COVID came, we didn't do anything. Last year, we did Nairobi County. And we had telemedication. We had a meds project where we were supplying medication for those who could not afford it across the country. But the main project that is attached to World Autism Awareness Day, which is the gap that we have seen, is education and therapy. So we're trying to equip classes and therapy units so that they're able to offer occupational and therapies that will help the children. So we're doing this as a fundraiser and we have sponsors sometimes who come. So last year we did Kasarani Primary School Autism Unit, but you see now that also highlighted a different challenge that I'm talking about, cooperation between our ministries. So we built the center. Remember, it's a government school, they don't have the resources. We requested the next dispensary, which is a government hospital. They have the therapists, they don't have the resources. So we said, can't we come together or can't the Ministry of Health support us with therapists? Because we are trying to just support for the benefit of the children. And the sad reality is, that's Ministry of Education. I don't know, at some point there was issues, they stopped supplying therapists. And I'm like, that's basic, very basic. You have the equipment. So we have equipment, but then we don't have the specialists. And when we have a government that doesn't have the equipment, what is so hard in working together for the benefit of the children? And we're championing for therapy being part of education. I sit in KICD, and that's one of the things, Committee for Academic, and as we're going through the curriculum, that's the one thing I'm insisting. Advocacy has to start from when a child is young, because they need to know we are all different that way. Even as they grow up, they'll not be judgmental. As they grow up, when they're making decisions, they will remember there is someone somewhere who needs to be given a different accommodation. So we start with it when they are young. So education is key, and also equipping. Remember when I was saying massage only, therapy is not just the massage, it is a whole activity. So we are hoping also to know, at least if we have all level 5 hospitals getting well, then that way, if people communicate, this is the gaps, this is what we don't have, then if we run throughout the entire month of April. So we're challenging, you can wake up when you're at the gym, say, I'm going to be on the treadmill for 10 kilometers. 2 of those 10 kilometers, I'm going to dedicate for Autism Awareness Project equipping. So that's the challenge of the month. And we're working with Standard Group to raise awareness. So every day you go to the social media of Standard Group and Andy Speaks on Twitter, all across, you will find a fact about autism. So we want to make it a conversation. So how you can come in, you can retweet, you can contribute to your professional side of it. When sometimes we have interview opportunities, we want professionals, but people go like, I'm very busy, but it's part of your work to also educate, to be helping. So those, when we come upon such and the doctor is not available, if you're called upon, because sometimes we want a doctor to speak in mother tongue. I'm Kisi, but I can't speak Kikuyu.
Nice.
Hospital talk about autism, because the other thing we want is that we give the right information. So we need the right person with the right information.
Give the right information. That's correct. That's correct.
Very, very willing to also hold, like I know I did with the USIU psychology class, explaining what is the difference with the mental, and developmental. I'm very open to come and do lectures or collaboration to the right students so that we can make this awareness and advocacy
more multidisciplinary one.
Yes.
Yeah. So I'd like to give Dr. Lucia Molo a chance to speak. Maybe, Dr. how are you?
I'm fine, thank you.
Yeah, so great. Maybe you can tell us a little bit about you. I read your extensive note, and you can actually vocalize what you said. Over to you.
I'm a consultant pediatrician working in KNH. I'm not an autism expert, but I have interacted as a pediatrician with many patients who come with autism or with signs of autism. So probably, I think Sylvia has really hit the nail on the head when she has talked about the challenges that we have in Kenya, being a parent of a child with autism, the frustrations that you go through. And as she's rightly said, I think one of the biggest challenges we have is coming up with the diagnosis. However, what I can say is that we now have many neurodevelopmental specialists who are coming up in Kenya who serve as good moderators for the patient and the other clinicians. They have good developmental screening tests that can aid in making a diagnosis of autism. Just to mention a few, we have Dr. Wamithi in Aga Khan, we have Dr. Florence Oringe, Dr. Madumadu, Dr. Alia, who I believe are in Gertrude's. We also have others who are currently in training. So hopefully we'll be able to expand the number of neurodevelopmental specialists who can aid in coming up with a diagnosis of autism. So they're a good start because, as Sylvia has said, usually you need very many people involved. You need the OT, you need the speech therapist, you need school. School is very important. So it's sometimes very difficult figuring out school placement for autistic children, but there's a list that many clinicians have. If, as she said, autism is a spectrum, it can be mild, moderate, or severe. So those who are mild to moderate can actually go to integrated schools. Integrated schools are schools where neurotypical or normal children usually go, and the autistic child is allowed to attend some of the classes, but receives special attention in addition to that. For those who are on the severe end of the spectrum, they usually need to go to special schools such as Kise, Jacaranda, which are readily available. We even have public schools like City Primary that take autistic children. So this list is out there. But of course, as Sylvia said, you need somebody who points you in the right direction. I think another important thing to mention is we have what we call ABA, that's applied behavior therapy. This is the latest therapy that has been proven to somewhat help patients who have autism in developing life skills. Unfortunately, it's not very reachable right now. We have, I think, 3 or 4 available in Kenya. It's very, very expensive and requires commitment. However, we have some ABA therapists who are in training in Kenya. I know of one. She's actually the wife of an obstetrician in Kenya. So in case you need contacts for that, I can point you in the right direction. I think what I can also mention is for parents, as Sylvia has said, the most important thing is to recognize the red flags. And for autism, mainly you'll notice problems with social interaction. Your child will not want to interact with other children. They may not have eye contact. Like if your child is school going, you'll notice that they prefer to spend time on their own as opposed with other children. Delayed milestones are a major red flag, not just motor milestones. Most of the parents, the first thing they notice is speech. The child is not talking as expected. They also tend to have certain TPs or abnormal behaviors such as hand flapping, head banging, tugging the ears, tiptoe walking. So these are also things that would tell you something is not right. Lack of eye contact, violent outbursts or tantrums are a major issue. And these tantrums can get quite bad, especially as the child gets older. I know of a child who actually threw themselves on a glass table and ended up sustaining quite some injuries. So violent outbursts and tantrums are a big, big issue in autistic children. And as Sylvia said, sometimes you end up being labeled as having a psychiatric illness, but there are actually medications that can help for autistic children. Risperidone, aripiprazole are medications that are prescribed for autistic kids who have very violent outbursts, but we know all of these medications can have side effects, but they can help. Sleep disturbances, usually kids with autism have a problem with the circadian rhythm. So sometimes a parent will come and tell you, mtoto wangu yuko macho, doesn't sleep until 4 a.m., the child is just up and about. So usually melatonin is prescribed for that. However, melatonin is just for initiating sleep, but not for maintaining sleep. So it will help the child fall asleep, but it doesn't assure you that the child will be asleep throughout the night. So you tend to find many parents come with problems of sleeping. There are many sensory issues for children with autism. They don't like loud noises. So there are devices like noise cancellation devices that can be used. Sometimes you'll find that your autistic child will be nonverbal throughout their life. They're actually devices. This is more so in European countries, but they can be brought to Kenya, especially with advocacy, which autistic children can use to communicate. So if your child is having speech problems, it's always good to work with a speech therapist very early. Of course, we have problems like ADHD, depression, which can come about especially in the teenage years for these autistic children. So there are lots of comorbidities that come, including what Sylvia had mentioned, which is seizure disorders. Well, in terms of diet, what I know is that there was a study published by Lancet. I think I saw someone ask about diet. Well, diet is very important. There was a study published though by Lancet about gluten-free diet. They say that gluten-free diet has no association with autism. So I know that's quite controversial because some clinicians do prescribe gluten-free diet, but it has not been shown to have an association. A lot of autistic children who are on long-term medication, such as the risperidone, aripiprazole, end up having side effects such as, because these medications can increase your appetite. So you may find that they're having feeding issues and they feed excessively. I think that's what I can mention. Also, maybe what I can mention is there's a lot of information out there. Autism is not just not well understood in Kenya. This is actually a worldwide problem. We've not figured out the etiology or the pathophysiology of this illness. However, there's a lot of resources out there. There's a lot of support groups out there, especially among European countries, where you can actually see what has been done. I'd encourage you to read about the applied behavior therapy and how it has been shown to assist children with autism, such as people like Dr. Kabon, who is a doctor based in the UK who has done a lot of ABA studies. Yes, I think that's what I can mention for now, unless
Thank
there's anything
you.
specific.
No, thank you. Thank you very much, Dr. Lucia, for the brief summary of what is available and what to do. I must say, Sylvia, this was a very engaging conversation. You brought out a lot of things that people don't really talk about, but they need to hear, they need to talk about, they need to know how we can make our services better as healthcare professions. And the biggest take-home message is let's be the best advocate for better healthcare. And the best way to do this is by working together from a multidisciplinary perspective in terms of there's the rehabilitative care, there's the neurology, there's the developmental, there's even the social worker, the nutritionist who are coming on board on all of these things. And usually the trend in Kenya is multidisciplinary can have a lot of gaps, especially in areas whereby you have a little bit of everything. So Sylvia, thank you very much for the very informative perspective from a parent and also from an advocate. Keep going strong. We will light it up blue. Unfortunately, I was unable to join in. However, maybe you can give me your parting shot for the end of the session.
Okay. Thank you very much for having me and giving me the platform to share at least what the journey is like. I have a presentation on autism, whatever Doc had said earlier, signs, symptoms, etc. I will share that with you. I will compile the full neurodevelopmental disability signs, symptoms, etc. All of that. That's for the lecture I did in USIU, and then I'll add on the challenges, etc. And yeah, please let us light it up blue this month of April. Anyone who would like to participate, we are working on a portal, by the way, called Special Needs Info Hub. And one of the things, if like the doctors you have mentioned, if you could kindly email me for doctors who offer these services and are willing, or hospitals, so that we can have it in one place, because the same, and the schools available also, and like EAC centers and contacts. So we're trying to put all this information and the correct like what autism is, signs and symptoms, the procedure. So we're doing that. And we would be very happy if we could find a donor to help us. We've done the basics, but we need some insights also sometimes to get this actualized. So at the moment, it's work in progress, and I'm very happy that at least you've listened and taken in. And any questions, you can reach out to Daktari for my contact. I'll be ready and willing to work with the organizations. And like I said earlier, we have flyers that I'll be happy if we could find partners who can just place them. It's very basic. It's what we are distributing to do autism awareness day. So generally the description and the characteristics of autism. So we have the language difference, social differences, repetitive actions to watch out for, and the sensory differences. So those are the most common that you will find. So we have quite a good number available. You can give us the platform to share. I will share that, and I can share it also in soft copy. Thank you very much, and do have a very blue, positive, inclusive, accepting Autism Month. Thank you very much.
Thank you very much. Thank you for the audience for listening in, for engaging. We'll continue the discussions. Today we were just focusing on advocacy and also from a parent's perspective of autism. We'll meet again. I believe for me, we'll meet again for the nursing series on Wednesday. And I think there's a session tomorrow. So we meet again. Thank you very much. Bye-bye.